tanghali sa inyo mga ka-webinar. Happy New Year everybody! The first thing I'd like to say this afternoon sa lahat ng nanonood, congratulations to you! You did it! Because 2020 was a very difficult year but we made it, you made it all through. Second thing, gusto ko pong magpasalamat sa inyong lahat sa patuloy na pagsama nyo sa amin dito sa webinar na ito. Sana nagkaroon kayo ng lahat ng isang masaya, masagana at ligtas na pagdiriwang kasama ng inyong pamilya at mga mahal sa buhay. Dapat nating ipagpasalamat dahil sa gitna ng nararanasan nating pandemic at maraming challenges na effect nito, tayo ay healthy pa rin at well at patuloy pa rin nating nagagawa ang mga pang-araw-araw nating duties and responsibilities. Well, life must go on because the best is yet to come. So dun sa person beside you, sa katabi mo ngayon, pakitap mo yung shoulder at sabihin mo, ang galing mo bro, ang galing mo sis, cause you made it through 2020. Tap mo na din yung sarili mo kasi you survived it. So welcome 2021. Alam nyo bang nung nakaraang taon, nakagawa tayo ng 23 episodes ng ating nutrition and webinar series at marami tayong natutunan dito sa aspect ng physical, mental health, and wellness. Dahil ito ay isang community service ng Farmacia Jimenez Corporation, ito ay ipagpapatuloy natin ngayong taong 2021. So samahan niyo kami sa mga susunod na episode tuwing Sabado. Para sa unang episode ngayong taon, ang topic po natin, Gingivitis and Periodontal Disease. Our today's sponsors, Oral Nymphaea Mouthwash, Cell Life Pure C Vitamin C, your partners for stronger gums and optimum oral health. I'm Grace and I'm going to be with you for the rest of the hour dito sa ating Nutrition and Health webinar. Sa panahon ng pandemya, kung pwede lang, sana maiwasan natin huwag magkasakit. Kaya we need to avoid all preventable illnesses and infections during this time. Establishing good oral health has a direct impact dun sa ating overall health. Kaya alam natin that mouth is an easy gateway to all microorganisms, protektahan natin to. Ang sabi ng Department of Health, if I may quote, the most common oral health illness among the Filipinos now are dental caries o yung tinatawag na bulok na ipin and periodontal disease or gum disease, yung sinasabing sakit sa gilagid. Around 87.4% ng mga Filipinos are suffering from dental caries while 48.3% merong gum disease or sakit sa gilagid based on the 2011 National Monitoring and Evaluation Dental Survey. Gingivitis and periodontitis are major causes of tooth loss in adults and affect the nutrition of children. So, mahalaga ito. Kaya ngayong hapon na ito, ang tanong, paano ba natin maiiwasan ito at ano ba ang pwede nating gawin kung nararanasan natin ito? Ngayong hapon, we are blessed and we are so privileged na sasamahan tayo ng isang subject matter expert na magbibigay linaw sa mga bagay na ito. Nag-invite tayo ng isang subject matter expert sa larangan ng dentistry at bago ko i-introduce sa inyo, ako na ang nagsasabi, magandang opening natin ito sa year 2021 dahil tayo ay nabiyayaan o na-bless ng isang guest speaker who is a graduate of the University of the East College of Dentistry noong March 1992 at nag-pursue siya ng kanyang orthodontics sa Manila Central University Certificate Program in April 2000. And she also was a past president ng Periodontal Dental Chapter kung saan nabigyan siya ng outstanding award for the chapter and president for NCR in 2008. After taking the Philippine Academy of Aesthetic Dentistry Aesthetics 101 in 2009, she pursued higher learning in aesthetic dentistry and completed in the University of California, Los Angeles Aesthetics Continuing Course on October 2011. That same year, she became a board of director of the academy. So she is currently also the president of the Philippine Academy of Aesthetic Dentistry, and she even had her training also from the UPPGH College of Dentistry in implantology. So bigatin yung guest natin this afternoon. Couldn't wait to introduce her. Welcome and maraming salamat, Doktora Geraldine Abisamis Cruz.
Hello, magandang tanghali sa ating magandang anchor host, Dr. Grace Jimenez, and to all our viewers and listeners, good afternoon.
Salamat, Doktora. Hindi ka lang maganda, pati ang clinic mo napakaganda. So sa mga nanonood sa atin mamaya, maaari niyo pong matagpuan ang clinic ni Doktora. I-advertise natin 'yan. Makikita niyo naman sa screen natin. Kasing ganda niya at kasing linis ang
Di
kanyang
naman.
clinic. So nag-invite din tayo ng isang mommy guest to share with us her personal experience regarding the topic, and she's going to turn 31 years old tomorrow. Married and has a 12-year-old son. Good afternoon, Mommy Jenny Abarnas. Hi, Mommy Jenny.
Hello, Ma'am Grace. Good afternoon, Dr. Gigi, and to all viewers po. Magandang tanghali po sa
Hello.
lahat.
Thank you,
Hi.
Mami Jenny. Thank you, Dr. G. Dahil napapanood tayo via Facebook Live sa ating mga Facebook Live viewers at YouTube Live viewers ngayon, you can post your comments below. At ang ating subject matter expert will answer some of your questions. If you find this webinar interesting and valuable, please don't forget to share this event to your Facebook friends and Instagram friends. And don't forget to hashtag it. Just type hashtag Oranim Thera Mouthwash, hashtag Natural Oral Protection, hashtag Mouth Rinse, hashtag Stronger Gums and Teeth, hashtag Fresher Breath. Salamat, Sir Rene, sa mga hashtags mo, sa mga Facebook Live at YouTube Live viewers na mag-a-actively participate at magstay hanggang matapos ang entire broadcast ng ating webinar. You will have a chance to win a special gift pack from our sponsors. So, wag na natin patagalin. Today is Saturday. Salamat, Dr. Gigi ulit. May pasyente siya bago tayo nag-umpisa, and I'm sure naghihintay ibang pasyente pa. Umpisahan na natin, Dr. Gigi, ano ba ang gingivitis at ano ba ang periodontal disease? Ano ba ang difference nitong dalawang ito at paano ba natin maiiwasan ito? Yes, Dr.
Yeah, okay. Yeah, I have prepared a very short lecture about, of course, the definition and to differentiate as well. Kasi marami sa ating mga pasyente or sa ating mga nakikinig ang hindi nila alam actually talaga what is gingivitis and how to differentiate it from periodontitis. So I have prepared a very short, informative lecture regarding these two topics.
Sige, Doc G. Yan.
Yeah.
Alright. Doktora Gigi, ano ba daw Tagalog ng periodontitis? Ano bang common layman's term ng periodontitis?
Actually, when we say gingivitis, that is commonly known as, in layman's term, parang pamamaga ng gilagid, no? Parang ganun. And wala talaga siyang Tagalog sorry ha. But the scientific term is gingivitis and periodontitis. When we say it's periodontitis, it's also a gum disease, but it is more advanced. So, gingivitis, parang local inflammation or pamamaga, while periodontitis, it involves more other tissues like the bones and the periodontal ligaments. So when we say periodontitis, it is more serious. It's a more serious problem. But it all started from gingivitis. Parang that is the most common. The most common of all the gingival disease or ang pamamaga ng gilagid. Yan.
Okay. Thank you, Doc Gigi. Salamat po for that information.
Yeah.
Okay. So, nakikita na natin sa screen, Doktora, yung iyong ginawang short presentation for us.
Yes, yeah. Good afternoon. So, and Happy New Year. Yan. So, my topic for today is gingivitis versus periodontitis. There. Okay. To start with, let me define what is gingivitis. Gingivitis, it is a common and mild form of a gum disease or periodontal disease that causes irritation, redness, swelling, or what we call it inflammation of your gums or gingiva that is part of your gum around the base of your teeth. So, in common term, gingivitis actually it is bleeding. Parang it is usually associated with bleeding of gums. Now, let's take a look. What does a normal gum and a diseased gum look like? Diba? So, on my left side, that is the healthy gum. So, if you notice, the color of the gum or the gingiva is light or coral pink. And as compared to the one on my right, which is the diseased tooth or the one with the gingivitis, you notice that the color of the gum is dark red and the tooth is crying. Yeah. So easily you can detect which one is a good gingiva or good gum versus the one with a gingivitis. Huh? Okay, let's talk about the common causes of gingivitis. So what are the common causes of gingivitis ba? Siyempre, number one, poor oral hygiene. So, when we say poor oral hygiene, ano ba ibig sabihin nun? Hindi nagtutoothbrush and you don't actually do flossing and ano pa, you don't go to your dentist. Yan. So kasi when we say good oral health habits, it should be, we always tell our patients to brush their teeth at least twice a day. Twice na lang dapat actually 3 times. But if you can't really do a lunchtime brushing, at least in the morning and before bedtime. Yan. So at least twice a day. Then flossing, when you say flossing, of course you have to floss at least once a day and getting your regular checkup to your favorite dentist. Yan. So those are the good oral health habits. So pag wala ka doon, yun, that will be the start of your journey to gingivitis or bleeding of gums, yan, and or inflammation of gums. Yan. So ano naman yung mga signs and symptoms when we say a person has a gingivitis? Yun, as I've said kanina, no, nakita natin from the picture, the color of the gums is dark red. And it is usually swollen or namamaga, no? And another very common sign is the bleeding. So when there's inflammation, definitely there will be bleeding, no? And another thing is bad breath. So you don't want to have bad breath. So you have to have good oral hygiene habits, no? And some would have receding gums and some would have tender gums. Yung when you touch it, it's really painful, ganyan. Those are the signs, the common signs of gingivitis. So, Is it getting interesting? Nakaka-relate na ba kayo? Yan. So, what are the common causes naman? So, common causes, most of the time, no, gingivitis is associated with poor oral hygiene. As I've said kanina, no? Kasi, when you don't get to brush your teeth, the plaque stays in the surfaces of the teeth. Yun ang nagiging cause ng irritation of your gums. And later on, it causes inflammation. So there. So, yun. Kaya nga, we always encourage good oral hygiene habits. So, ang start talaga ng gingivitis is yung plaque formation. Yung plaque formation, yun nga, di ba? It stays in the surfaces of your teeth, you know. Nakita nyo yung parang film siya actually. It's not actually, it can't be really seen. Pero sigurado yun, you're eating and then, syempre, you're eating 3 times a day. It leaves a very thin film of food debris. Yun yung nagiging cause ng plaque, no? Doon, nagpo-form siya. Tapos, ano ang next step dun sa plaque formation? Siyempre, it calcifies. Tumitigas yung plaque. Ang nangyayari sa kanya, nagpo-form siya ng tartar. So, I'm sure naririnig nyo yun madalas, di ba? Ay, may tartar siya, oh, di ba? Di ba? Parang pag sinabi sa'yo na may tartar ka, parang, di ba? Yak kadiri, di ba? So doon nanggaling yung tartar. So at first, soft muna siya, yun yung plaque. And then it calcifies, nagiging tartar. And then, yun na, si tartar na yung culprit. Siya na yung dahilan kung bakit nagkakaroon ng inflammation and irritation of the gums and then bleeding. So yun na. So alam na natin yung history, how gingivitis started. Okay. So, syempre, once alam na natin yun, ito yung diniscuss ko kanina, di ba? So yun yung plaque, yung start yung plaque. And then it becomes a tartar. And then, ayan, it becomes inflamed already. It becomes a full-blown gingivitis. Ayan. Okay. So, what are the, syempre, yun nga, as we said kanina, as I've said, no, once you know already how gingivitis starts to or progress, no, we have to know naman kung ano yung mga factors, yung mga risk factors that affects gingivitis, that involves gingivitis. Kanina ko pa sinasabi yung good oral hygiene, di ba? So ano yung risk factors of having gingivitis is the opposite of it, which is poor oral hygiene or poor oral care habits. And then, number 2, na high risk factor is smoking or chewing tobacco. Kasi meron tayong mga patients na would still practice. They don't really smoke, but they chew. They chew, alam mo yun, yung sa matatanda, it's nga, di ba? Pero meron din talagang nag-chew ng tobacco. So it's also one of the highest risk factors, no, for having gingivitis. And number 3 is old age, older age. So as we grow old, no, physiologically, syempre, nagiging prone tayo to have gingivitis. That's why we need to really have good oral hygiene or good oral habits. Okay? And then, next risk factor is dry mouth. So, bakit nagkakaroon ng gingivitis when you have dry mouth? So, it's good talaga to hydrate yourself. So, always drink plenty of water. because it will lessen your risk to have gingivitis. Okay, and then what else? We have poor nutrition, or you lack vitamin C, mga ganyan. And then others, other poor nutrition, you're not eating vegetables like that, di ba? So better pa rin to really eat your greens, eat your vegetables. Yan. And then for some naman, they have a high risk factor when they have hormonal changes, like during pregnancy, because when a mother is pregnant, nagbabago yung hormones niya sa body niya. So nagkakaroon ng hormonal changes. That's why the risk factor of getting gingivitis is high. Yeah. And then other factors like that we can attribute the gingivitis is dental restorations, or yung mga ill-fitting dentures, yung mga ganyan. Or sometimes when we say ill-fitting dentures, sometimes kasi if the denture is not fitted well, 'di ba? Sometimes it presses the gums, 'di ba? Yung mga ganun na area. So whenever you have problems like that, you have to consult your doctor right away, your dentist right away, so that the problem will be addressed, di ba? It has to be addressed right away so that it will not lead to any local irritation or gingivitis. Then others naman would have yung mga conditions like leukemia, and then cancer patients, and even HIV patients. Some would really exhibit mga gingival inflammations as well. And there are also certain drugs like the ones that we administer for epileptic patients. So normally they're taking dilantin, no? Dilantin sodium. So there's a study that this drugs causes inflammation of the gums. Yeah. Okay. So how do we prevent it? So syempre, we have known already the cause, the risk factors. So how do we prevent it naman? Syempre, number one is good oral hygiene. So ayun nga, as I've said, at least you have to brush your teeth twice a day. One in the morning and one before bedtime. And syempre, mas maganda kung 3 times a day. If you have like nowadays, di ba, lagi lang tayo nasa bahay. Dati kasi, if you're in the school, pag nasa eskwela ka, or nasa office, and you know, sometimes it's hard for you to brush between office hours or school hours. Diba? So yon. Pero ngayon kasi nasa bahay na lang tayo, diba? Most of the time. So it's really very good, and we highly recommend for you to brush your teeth 3 times a day. So morning, lunch, and dinner time. Right after dinner time. Okay. And then number 2, for us to prevent gingivitis is number 2 is visit your dentist at least once a year or every 6 months, diba? Very good ka if you visit your dentist every 6 months, but if not, like ngayon, syempre pandemic, diba? We wanted to limit our exposure to the world, diba? So at least once a year. So if you haven't gotten any dental checkups for the year, and it's a very good start of the year to start to visit your dentist. Okay? And then number 3 is good health practices. So ano yung good health practices? Syempre, as I've said, and I always emphasize this to my patients: brushing, flossing, regular dental visit, and use of oral mouthwash. So, syempre, of course, I would like to recommend Oranim. I normally prescribe to my patient after dental prophylaxis. So after cleaning, at least for maintenance, they need to do oral rinse after brushing. Yan. So that's an additional to protect yourself from having gingivitis. Yeah. So these are the ones that you get, no, that you get from us when you visit your dentist. So yung number one is plaque and tartar remover or the cleaning. Yan yung cleaning or prophylaxis if you hear it, 'di ba? We call it oral prophylaxis. We don't actually normally use scaling. Scaling pang amin yan, pang dentista. Pero for our patients, it's most commonly known as oral prophylaxis or cleaning. Ayan. And then, we always tell our patients to practice good oral hygiene and how to effectively brush their teeth. So, just to give you a short review on how to brush your teeth the right way, no? For the front teeth, you brush it up down. For the posterior teeth, you brush it circular or paikot-ikot, di ba? Circular. And then you brush also the top of your teeth horizontal. Yung occlusal part, which is the table, parang table nung molars natin. And then for the front na lingual, which is sa ilalim nung front teeth natin, you do it front and back. Ayan. So, ayan, short review lang yan on how to effectively brush your teeth. And then, follow up, you have to have follow-up visits, no, if it's necessary. So normally, when we see our patients, we can tell that the patient needs to have a follow-up or second scaling. Or kasi nga, if you have gingivitis, normally we ask the patients to come back so that we can check, if the gums improved or healed. And then if not, we need to do a second visit or second scaling. Yan. And then, ayan. And then we emphasize nga yung good oral hygiene habits. So those are the ones that we normally do to our patients in the clinic. No. Ano naman yung mga home care, that the ones that you can do at home? No? So yan yung mga sinasabi namin sa mga patients na syempre wala naman kami everyday dun sa bahay niyo, di ba? On your own homes. So these are the ones that you need to do as your, kumbaga, that's your part naman of maintaining a good oral hygiene is brush your teeth at least twice a day, and then so that you can have a good and good oral hygiene. Yan. And then flossing also, it will also help, maintain and a good oral hygiene. And lastly is regular rinsing of your antiseptic mouthwash. So if you don't have any, I would like to recommend again Oranim, because that's the one that I recommend to my patients, especially for my patients with gingivitis. Yeah. Okay, so there. So we're done with gingivitis. So let's go now to periodontitis. What is periodontitis naman? So later on, I will correlate gingivitis and periodontitis. But for now, since we're done with gingivitis, I'm going to talk about periodontitis. So periodontitis, this is the another type of gum infection or gum disease that is more serious, di ba? Yung gingivitis a while ago, that is inflammation of the gums, di ba? So this one is the serious one, the serious type, no? Because how? Why? Because it damages not just the soft tissue, which is the gums, but sometimes it also involves and destroy the bone part of your jaw where the tooth is planted, no? Where the tooth is housed. So I'll show you mamaya how it looks like. So here in the illustration on my right, um, I have here an illustration of how a normal tooth looks like and how the periodontitis tooth looks like. Yeah. So, if you notice, di ba, I've mentioned kanina bone. So, this is the bone part of of the the jaw, okay? So, this is where the tooth is being embedded. So in between the tooth and the bone, there is a soft tissue which is called the periodontal ligament. So that is the one that suspends the tooth to the bone. Okay? So when we have a normal tooth, yan, ito yung normal. This is the tooth, the enamel. Enamel is the outer portion of the tooth. It's the one that covers the tooth, no? Now, this is the gums and this is the bone. Now, when you have periodontitis, this is what happens, no? This is the one that is called calcular deposit or tartar. Diba? I've mentioned kanina, the plaque calcifies, therefore it becomes the tartar or the calcular deposit. Calculus, yan. So, when you have the calcular deposit or the plaque or the calcular deposit or the tartar, not the plaque, um, it irritates the gum. So ayun, so you notice that there is an inflammation already, no? So it becomes swollen. So if you compare this from the picture on the left, 'di ba? The gum is so attached. It's attached already. It's healthy. The color is pink. And here, the color of the gum is red. And there's already a space because of the swelling that was brought about by irritation from the calcular deposit. So ito yung bone natin. So nangyayari, nagkakaroon siya ng space because of the inflammation. And because of the calcular deposit, nagdideepen yung gum, nagkakaroon ng pocket. So sa aming mga dentists, we call it periodontal pocket, no? So para lang siyang parang pocket, 'di ba? Anything that has a space, 'di ba? And then parang pouch siya, mas natatrap doon yung calcular deposit or yung tartar. Yan. So, just to give you again, 'di ba? I've shown this picture kanina how a healthy gums look like. A healthy gum looks like, and the one with the gingivitis, and this is the one with periodontitis. So if you compare these three different pictures, no, the normal or the healthy gums, of course, healthy siya, di ba? The tooth is smiling now. So the color is pink, where in gingivitis, there is already it started already to have darkening because of the inflammation. And it's causing bleeding, no? in periodontitis, it becomes more advanced. So the calcular deposit becomes hard, it hardens, so it becomes a tartar, and it causes not just inflammation but deepening of the pocket, thereby sometimes it also produces bone loss. So in more advanced periodontitis, nagkakaroon siya ng mobility or pag-uga ng ipin. So doon muna magsisimula. Una, syempre healthy, di ba? So pag nagkaroon ka ng you have poor oral hygiene, you don't go to your dentist, di ba? Nagkakaroon ng gingivitis, di ba? So if the gingivitis is not treated or is just left there, napupunta siya sa periodontitis. So pag may periodontitis na, yan, not just inflammation, bad breath, and then when we say bone loss, yun, umuuga na yung ipin. So kung nakakakita kayo ng mga patients or mismong kayo, meron kayong mga umuugang ngipin, not because of any cavity, walang sira yung ipin. Actually, most of the time, walang sira yung ipin, pero nakikita nyo umuuga. So, yun. Yun yung more advanced ng periodontitis. But it is also a type of periodontal disease, no? It's just, that is the, kumbaga, yung pinaka, what do you call that? Parang meron pa actually meron pa siyang degree. Meron 1 degree, 2 degree, 3 degree. Pag 3 degree, extraction na yon. So imagine if you don't have good oral hygiene and then you don't go to your dentist, yun ang ending ng mga ngipin nyo na ginagamit natin sa pagkain. At syempre, aesthetics also, when you smile, ang hirap naman na mag-smile na bungi, diba? So, diba? So, you really have to maintain good oral hygiene. Yeah. So, ito, for symptoms of periodontitis, actually, it's just almost the same with the ones that I've talked about kanina, yung gingivitis. Only, ang symptoms ni periodontitis is more advanced or yun nga, mas malala siya. More, mas maraming effect or result kasi it will mauuwi. It will, mauuwi siya sa bunot di ba? So sayang ang ipin. And nowadays, actually, we are really advocating, no extraction sana, di ba? As much as possible, we really wanted to save teeth. Kasi, di ba, we don't want to be called, dentists would not want to be called Dr. Bunot, di ba? We're here to take care of your teeth, of course, and to maintain, di ba? Maintain your good dental condition. So, ayan, yun yung kanina kong in-explain din. But this is more, ito yung more advanced, no? Kanina parang up to here lang, up to periodontitis. The ones that I mentioned a while ago, yung bone loss and mobility because of the deepening of the pocket, ito na yung advanced periodontitis. And we don't want this to happen. Yung number 4, di ba? We don't want our teeth to just go to extraction. So, ayan. Kaya, I'm sure, diba? Wala naman sigurong gustong mabungi. So, we really have to take care of our teeth and it starts from us, from you, and with our health. Yeah. So, how to prevent it? So, yun nga, paulit-ulit namin sinasabi, you need to brush your teeth at least twice a day or every after meal. So, kung 5 times kayong kumakain, dapat 5 times din kayong magbabrush ng teeth, diba? And number 2, you need to use a soft toothbrush. And ito, minsan meron tayong sepangs or separation anxiety sa mga toothbrush natin. Ayaw nating palitan. Hindi po pwede yon. Dapat po every 3 months, no? Nagpapalit tayo ng toothbrush. Or pag nakita nyo na nakaganon na yung toothbrush nyo, it's already worn. Replace na right away. Because it also hurts your gums when you brush your teeth with worn toothbrush, diba? So, number 3 is you need to floss daily. Ayan. And then, prevention, also use antiseptic mouthwash or use Oranim to help reduce plaque between your teeth. And then, supplement brushing and flossing with some adjunct to toothbrush. We have interdental toothbrushes that we prescribe to patients with periodontal disease, no? Or pwede ring water pick. Yan. If you have at home, yan, that's a very good supplement, no? To supplement your brushing. And then, visit your dentist at least once a year. Ayan, at least once a year. And then, if you are smoking, this is the best time to quit smoking. Do not smoke anymore because you are increasing your risk of having gingivitis and periodontitis. Ayan. Then, as I've said, or na-mention ko na ba ito kanina, pero I always tell this to my patients, no? Prevention is better than cure. So with that, I'd like to end this presentation, this lecture. So you know how to prevent gingivitis and periodontitis. So let's concentrate on that, no? Because prevention is better than cure. So thank you very much and good afternoon. So if you have any questions, you can type in or you can ask questions now. Thank you.
Doc G,
Yes.
meron may mommy guest tayo.
Yeah. Si Mommy Jenny.
Mommy Jenny, welcome. And say good afternoon again. Dr. Go ahead, Mommy
Hello, good
Jenny.
afternoon, Doktora Gigi. Thank you for that wonderful presentation and sobrang marami akong natutunan sa lecture mo, Doktora. And I just want to tell a story or for my experience po about may isa kasi ako sa mga ortho patients. As you can see, I have braces po. So, nag-work din ako sa field. So, may mga times na may question lang ako, doktora. May mga times kasi akong na hindi nakakalimot ako mag-toothbrush, lalong-lalo na tanghalian kasi nasa field work nga ako. And minsan may mga nakakausap akong mga doctors. Hindi ko alam kung may bad breath na ba ako or ano kasi syempre hindi ako nakapag-toothbrush so medyo hindi ako confident doon. And at the same time, every adjustment nahihirapan ako kasi nagkakaroon ako ng singaw dahil nga dun sa ano and nahihirapan din kumain. Tanong ko lang doktora kung sapat na ba yung paggamit ng mouthwash tuwing after eating ko ng lunch, ganyan. Kasi parang ang nangyayari po every morning na lang ako nakakapag-toothbrush and then evening pag uwi ko, doktora. So, sapat na po ba yung paggamit? Or
I've mentioned kanina, at least twice talaga. In the morning, before you leave the house. Tapos, we cannot really prevent yung mga in between brushing, 'di ba? Hindi natin talaga minsan ma-commit eh. So, at least kung meron kang mas maganda if you can mouthwash, you you can have in your office at least mouthwash. O kaya, I have my ortho patients bring with them an Oranim spray. Oh, baka hindi mo alam to. Meron sila nito. So, kasi actually, I include this sa mga ortho patients kasi I'm an orthodontist
Yes,
talaga
Doctora.
by profession, no? I mean, that's my specialty. So, I normally give them at the start of my treatment to them. I ask them to get an ortho pack. So sinasama ko to dun sa ortho pack kasi you can refill this and then you can use it in between, syempre, especially if we're working, diba? It's hard talaga to commit to brushing on lunchtime. I would understand my patients. And yun nga. So if you have the spray, it's easier for you even if you're outside of the office, 'di ba? You can at least 'di ba? If you cannot
Yes,
really
Doctora.
brush, at least you have mouthwash.
Okay, Doktora. That's good to know, Doktora, kasi yun nga po, um, user din po ako ng oral mouthwash and for my experience po, nalilength nga po yung nagiging smooth po yung breath ko every time na gumagamit po ako nun, lalo na yung spray kasi very ano siya na dadala mo siya kahit saan ka pumunta, hindi siya masyadong
Yes, oo.
nadala.
Yeah. Pero syempre maganda pa rin talaga brushing.
Yes,
And
Doktora.
then, if you cannot really, there's really no way for you. At least, di ba, mas madaling gawin yun if you can just spray it around and then, gargle it for like 1 minute, 60 seconds, di ba? So that's good enough. At least, di ba?
Yes, Doktor. Additional po, Doktora, yung Oranim din namin. And every time na nagpapa-adjust na ako, nagkakaroon ako ng singaw, is na nawawala siya agad. So, hindi na siya nagiging sobra yung pagkakaroon ko ng singaw. So, gumagaling po siya agad.
Yes, oo, yes. Proven. Proven siya.
Opo,
Proven siya
Doktora.
actually.
So, yun lang po, Doktora. Meron akong last question. So, importante
Sige.
po ba sa health yung pag po ng mouthwash, Doktora?
Again, hindi ko narinig, sorry.
Importante po ba yung sa health, yung paggamit po ng mouthwash po, Doktora?
Yes, oo, definitely. I always tell my patients, no, it's good to supplement your brushing with flossing and your mouthwash. So, kasama na talaga siya as part of the oral health care regimen. So, it will be a good oral practice if you do those three: brushing, flossing, and then mouthwash.
Thank you, Doktora. Yun lang po yung question ko and thank you po.
Yes, you're welcome.
Thank you, Mami Jen. Nag-echo kami. Bakit kaya kami may echo? Ganyan talaga, Doc G, pag may live, ano? So, yun nga yung mga common concerns, I think, Dr. Gigi. Thank you for addressing all those. Bago natin ulit balikan yon, Doc, I forgot, I'm sorry, no? My bad. Hindi natin na-summarize lang. I think very important yung sinasabi nilang maintindihan nila na mouth is the gateway sa lahat ng microorganisms, di ba, Dr. Gigi? So, very important talaga that you take care of your oral cavity, yung bibig natin. Tama ba, Doc G?
Yes, oo. Yeah.
Na-mention
That's
mo.
very important.
Yeah, na-mention mo kasi, Dr. Gigi, kasi although ngayon kasi lately ang pinag-uusapan every time I open the television, it's more of aneurysm, the aortic aneurysm. So sabi nila, anong relevance ng topic nyo ngayon, Grace? Kasi lumalabas ang pinag-uusapan ngayon, yung aortic aneurysm. Well, doktora, ikaw mismo na-mention mo, no, na binabaliwala natin palagi yung oral cavity, yung bibig. When in fact, yun nga yung sinasabi natin, it is the biggest point of entry ng lahat ng microorganism. So, Even yung aortic aneurysm na yan, pinapakinggan ko kanina, saan ba dumadaan yung beer? Saan ba dumadaan yung mga toxins? Lahat yan galing dumadaan sa mouth. But you also mention yung importance ng eating all your greens, ano, doktora, your vitamin C. Tama ba?
Yes.
Oo.
Yes, and drink lots of water.
Lots of water. In fact, yung ating sponsor, which is our Pure C Vitamin C, is a very good
Yes.
partner, doktora. Dun sa iyong mga
Yeah.
greens, pwede rin naman Cell Life tablet natin, which is also very much available in Salstar Drug, Generica, TGP, and Mercury. So, going back to your presentation, doktora, sabi mo kanina, pag mild lang, yung sakit sa gilagid, yung namumula, hindi siya kulay pink, 'di ba, doktora? Yun dapat
Yeah.
talagang kulay ng gums natin. It should be pink. Once na naging red na 'yan, kasing ganda ng red ng nail polish ni Doktora Gigi, hindi na po maganda 'yan sa gilagid. Tama ba, Doktora G?
Yes, oo. It should be pale or pale pink or coral pink. Coral pink, yeah.
Yun dapat ang color ng gums natin na normal, na healthy gums.
Yes, that's the normal. When it becomes red, that's a very pathognomonic sign of a gingivitis. Kasi it will start to it will start to swell and it will start to bleed.
Yes. So, I think support talaga, meron din dapat yung nutrition dun sa side ng sabi nila pag you lack vitamin C, you're not getting the right nutrients, you also suffer dun sa tinatawag nating gingivitis.
Yeah.
So, Doktora, you also mentioned the importance of really seeing your dentist. Ngayon kasi, di ba, pandemic. Ang tanong ng nakararami, gaano ba kadalas ngayong may pandemya dapat makita ang iyong dentista?
Yeah, actually, di ba, I mentioned in my presentation kanina na the best talaga is to visit your dentist every 6 months. But, syempre, if you're busy, and especially now, I mean, the pandemic, and you don't want to be exposed, di ba, you don't want to get out of your house nga as much as possible, di ba? Essentials lang. So, at least once a year. And it's a good start talaga to start the year with your dental appointment. So visit your dentist para we wanted to remind them that to be honest with their answers, and we will take care of them. We are proud to say naman that our clinic is disinfected every time we accept patients. So there.
Yes, doktora, nag-agree ako dyan, siguro for better appreciation dun sa mga nanonood sa atin, pwede mo kami ikot dyan sa clinic mo mamaya. Ako excited ako to show them kung paano ka ready yung clinic mo to entertain new patients during this time of pandemic. Doktora, meron nga tayong first question dito from Mr. Jun Garcia. Happy New Year, sir. Thank you.
Happy New Year.
Sabi ni Mr. Jude, babalik ba sa normal yung receding gums kapag wala ka ng gum infection?
Receding, okay. Okay, first and foremost, you need to know what is the cause of your gum recession. So definitely, ang may gingivitis, nagkakaroon ng recession, especially if there is bone loss. So, ang nare-reverse actually is only the inflammation. Nawawala yung inflammation, but the recession after the treatment will not progress anymore. But the recession sometimes will not go back unless you do gingival graft o kaya pwede siyang i-reposition yung gums. Pero pag more advanced talaga yung recession, hindi talaga bumabalik to its original position. We need to do like surgery or gingival graft.
So, ayun,
Yon, Doc.
Mr. Jude, salamat sa sagot ni Doktora Gigi. Babalik naman at pag hindi bumalik, meron pa ring paraan, no, Doktora
Yes.
Gigi?
Yeah.
Meron pa ring paraan na ibalik kung sakaling walang natural way of going back to the original. Tama ba,
Yeah.
Doktora?
Yes, yeah, that's right.
So, you know, Mr. Jude, you can always see Dr. Gigi anytime. She is in Alabang. She has a very nice clinic dun sa, anong hotel yan, Dr. Crimson Hotel. Yan.
Yes. Crimson.
Si Mr. Jude. Thank you, Mr. Jude. And then, Doc, may text in question ako dito galing kay Miss Ivy Fernandez. Kakaanak lang daw niya, I think 3 months old, and meron din siyang toddler na anak. So, ang tanong niya, usually daw after giving birth, nagkakaroon ng parang gum inflammation o namamagay yung gingiva, siguro brought about by pregnancy ba daw o anong magandang gawin?
Yeah. I've mentioned in my lecture kanina na the hormonal changes can cause gingivitis. But if it's because of the hormonal changes only, right after the pregnancy, it will go back. But if it's because of plaque accumulation or calcular deposit, definitely you need to go to your dentist to have them removed. And then that's the time pa lang na mababalik yung gums mo if there is inflammation.
Yeah. So, it could be hormonal, ano, doktora? Or
Yes.
hindi talaga nagkaroon ng dental check-up si mommy during her pregnancy at nag-accumulate na yung kanyang plaque.
Yes, oo.
In fact, Dr. Gigi, if I may also mention, yung study ng Oranim together with Dr. Giselle Yumol and Dr. Angelic Mia De Jesus,
Nia.
I was in collaboration with Dr. Monique Briones, who happens to be an OB Chinese, sa mga buntis
Yeah.
na. Oo. And nakita naman natin how successful it was. Ang ginawa natin dun sa mga buntis na nagsasuffer ng mild to moderate gingivitis, pinagamit natin at tinuruan natin yung tinuro ni Dr. Gigi kanina na proper way of brushing their teeth. So, yung mga sumunod after giving birth, check up natin, so far wala namang effect dun sa kanilang baby at hindi rin nag-progress or hindi rin tumuloy-tuloy dun sa sinasabi ni Dr. Giging periodontal disease. Kasi, Doktora, tama ba yun? May mga pasyente ka bang naririnig? Sabi nila na nung bago silang manganak ng 5, kumpleto ang ngipin nila. Pagkatapos nila manganak ng 5, naubos. Doon sa mga nakikinig sa atin dyan, magparamdam kayo dun sa kung may katotohanan yung kwento na yan.
Yeah, actually, may katotohanan at meron din namang hindi, meron ding part na hindi, no? So, yun nga, sabi ko kanina, if it's brought about by hormonal changes, it will slowly go back to its original state or condition. But if it's because of the presence of calcular deposits, it has to be removed by your dentist, no? You need to have prophylaxis talaga. Kasi yun nga, if after hindi siya na-treat, di ba? If you thought that it's just because of the hormonal changes at nagkaroon ka ng gingivitis, then parang you're thinking, mawawala siya. Pero pag nag-persist siya, even after your pregnancy, ibig sabihin, you need to go to your dentist talaga. And the hormonal changes maybe is not just the reason. So, kumbaga, don't rely on the fact that if you're pregnant, may gingivitis ka. Pero paano kung after na, di ba? So, kailangan mo rin talaga, yes, you need talaga to go to your dentist. Yes.
Agree. I couldn't agree more, Doktora. Kasi binanggit din ni Jen kanina, ni Mami Jen. Si Mami Jen may 12-year-old na anak din. Kamusta mo, Mami Jen, yung son? Nakakabisita ba siya ng dentista? Is there a need for, yun yung sinasabi nila, if it's not urgent, don't. Ikaw ba nag-agree ka doon, Doktora? Tapos tanungin natin mamaya si Jen after mo sagutin yung tanong ko. If it's not urgent, don't see your dentist. Do you agree, Doktora?
No. Kasi talagang it has to be once, at least once a year talaga. Kasi How will you know for yourself if you have a good oral condition if you don't go of you or you don't get the advice of the professional, 'di ba? Kasi you don't just go to your dentist when there's already an aching tooth. Definitely, if there's a toothache, minsan nga it's cannot be saved anymore, 'di ba? Minsan pag pumunta sila for extraction na. That's sad, 'di ba? So, the patient kung 12-year-old siya, lahat 'yan permanent na eh. So, 12 years old, complete na ang set of teeth niya. Sumakit ang ipin niya. 12 years old siya. What will you do? So, dadalhin mo na siya ngayon sa dentist. Eh ngayon, yung first molar niya, which was there or erupted at age 6, akala natin temporary pa. So what will you do? Extraction na pala. So you lost one good permanent tooth. So how will you prevent it? Dalhin mo siya on the earlier years. Dapat sinasanay natin yung patient, yung mga anak natin to visit the dentist kahit walang problem, kahit walang sumasakit. That should be part of your routine every year. Kaya nga January, it's a good start for you to go to your dentist or to visit your doctor so that you'll know the condition of your oral health. And then from there on, 'di ba? You'll know if there are teeth to be filled, if the gingiva or the condition of your gums is good, 'di ba? If there are tooth to be extracted. So from there, malalaman mo na and then dapat gawin mo na siya na yearly. Gawin mo na siyang annual. So that parang ikaw pag nagpapa-check up ka, 'di ba? Pag nagpapa-check up tayo sa doctor every year, 'di ba? So make it also a habit to visit your dentist every year. Yan.
Yan. So, every year, Mami Jen, balik tayo sa'yo. Kamusta ba si Yan, your son? Binigyan mo na ba ng panahon? Kasi sabi ni Doc G, it has been 9 months since ano tayo, na quarantine.
Yes.
Mo ba? O pinapractice mo ba yung kinukwento ni Doc G about handling our toddlers or our children? Yes, Mami Jen.
Yes, Ma'am Grace, medyo guilty ako doon kasi isa ako doon sa hindi ko masyadong na bibigyan ng pansin nga yung pagpapa-check up doon sa baby ko. Although, pinapractice ko siya na mag-toothbrush every day, 3 times a day, and yun nga, mag-mouthwash, and then check niya maigi, mag-flossing, ganyan. So, medyo guilty nga ako kasi hindi ko na-check kung mayroon na ba siyang plaque or any formation na sirang ngipin. So, yun nga, this year, yan isa sa mga plans ko na mag-visit sa dentist together with me kapag nagpa-adjust ako, doktora. So, thank you very much po sa information na kailangan po talaga or importante din pala na ipa-check every time and then sa mga baby, lalo na sa mga bata, doktora, para ma-prevent din tsaka magkaroon sila ng mas magandang smile. Diba, doktora?
Yes.
Habang pagtanda.
Correct.
Yan, doktora.
Thank you, Mami Jen.
Yes, Doc. Thank you din, Doc.
Thank you,
You're
Mami
welcome.
Jen. Oo. Thank you, Mami Jen. Doc G, yung
Yes.
tanong ni Miss Ivy Paves Fernandez, yung nagtanong kanina, nakakapanganak lang, pwede na po bang magpabunot after 3 months of giving birth?
Actually, pwede siyang magtanong sa kanyang OB. Pag may clearance na siya to do extraction, if there's any tooth that needs to be extracted, pwede siyang hingi ng clearance from her OB.
Ayun, Mami Ivy Fernandez, thank you for watching. Say hello to Sir Roger. And yun ang sagot ni Dr. Gigi sa'yo. I'm sure madaling sundan lang yon. Si Dr. Amado Roberto Jimenez Abreu is watching. Saying hi to you, Dr.
Hi, Doc Bob!
Which is better po? An electric toothbrush or the ordinary toothbrush? Kasi si Doc Bob is, ano bang tawag dyan? Hindi naman, ano ba sasabihin ko? Ano yun? Ano ba yun? The old norm. Na ano? Yes, Dr. G.
Answering ko ba yan?
Sa tanong ni
Actually,
Bob.
para sa akin kasi, any brush will do. For as long as you do the correct technique of brushing, there's no actually There's no, we don't really prescribe a brand or any brush. Pero we tell them lang na at least dapat soft bristles, ganyan. Pero for our patients with cervical abrasions, alam ni Doc Grace yan at saka ni Doc Bob, we tell them to get a mechanical brush. Why? Hindi namin 'yon pinopromote. Kaya lang kasi there are patients talaga that they cannot control how hard, especially if they brush. Sabi ko nga, 'di ba? If you don't brush properly or correctly, the method of brushing for your molars, and they cannot control it. The reason why we prescribe a mechanical, kasi when you use a mechanical, you just put them, you don't scrub. So it's mechanical nga, so it circulates, diba, by itself. So it prevents you from brushing hard. So that's the reason why sometimes we prescribe the mechanical toothbrush. Yeah.
Oh. So, Doc G, yung mga nagkakaroon ng yung iba nagugulat ka, sasabihin nila baka pwede pang i-save kasi gumagalaw na kasi walang sira, ano? Yung pala pag
Yeah.
mo, wala nga sira, pero sobrang bumaba na yung kanilang gums.
Yes.
Sobrang nag-recede na, 'di ba, Doc G?
Mhm.
Primarily because, can you say, because of the wrong toothbrushing technique?
Pagka yung recession kasi, it could be brought about by bone loss din. Pwedeng bone loss. Kapag normally ito nangyayari sa akin, after deep scaling and polishing, pagkatapos kong maggawa ng ganon, nagkakaroon ng gum recession. I tell the patients na before I do the surgery, sinasabi ko na that there will be gum recession. Kasi it parang hinahanap niya yung true pocket. So after yung true cervical margin, not pocket. Kasi 'di ba, pagka yung patient may pocket and then after the surgery, nagsishrink siya to where the true attachment is. So pagka ganun yung case, nawala yung mobility, pwede pa siyang ma-save. Pero pagka talagang it's beyond restoration na talaga, ang sinasabi na namin talaga sa patient that this kind of mobility cannot solve it with surgical treatment. Sinasabi na namin that there's a possibility that you will lose this tooth. So, ganon. It's always good to educate your patients, to tell your patients. And then, after that, naiintindihan naman nila and meron naman that we can save talaga. But there are really cases that we can't. So, dapat lang, alam ni patients yun. Alam nung patient yun. Yeah.
Dapat lang alam niya. And there's no better way to know that patient kung hindi ka pupunta sa iyong dentista para
Yes, definitely. Oo.
Clinical diagnosis. Doktora Gigi, sumunod pa si Dr. Bob, what's the best toothpaste? Hindi po tayo nagpo-promote ng toothpaste, pero nagtatanong si Dr. Bob, sasagutin po yan ni Dr. Gigi for gingivitis and periodontal disease.
Okay. Sabi nga natin, di ba, hindi tayo nagpo-promote ng any product for as long as you have 1,500 PPI content of fluoride. So, yon. Siguro train yourself to check whatever brand you are using. If the toothpaste has 1,500 PPI of fluoride, that's very good. That's very good. So below that, it's not recommended. So medyo commercial 'yun. So use your judgment. So what kind and what brand you will use.
Yes.
Yan.
Ayun, Dr. Bob, ang sagot ni Dr. Gigi, walang specific brand. Pero sa mouthwash, merong available na Oranim sa clinic ni Dr. Bob at sa Mercury at South Star sa Shangri-La kung saan malapit
Yes.
Dr. Bob na matatagpuan.
Yeah.
So, Doktora, kasi limited lang ang time natin. Bago tayo magsara,
Yes.
we're going to give a bonus sa mga nanonood sa atin. Saan ba matatagpuan ng clinic mo? At pwede ba naming makita yung sinasabi mong setup na new normal ready pag ganito. So, hindi kayo dapat matakot to see your dentist. Pag ganito po ang clinic nyo. So, lahat ng nanonood, pakitignan nyo lang po at ipapakita sa atin ni Dr. Gigi ano ba dapat ang nakikita natin once pumunta tayo sa isang dental clinic sa new normal. Yes, Dr. G.
Nako, ganun ba? Actually, hindi naman. Hindi ko na kailangang sabihin. Pero, I mean, na-tour sila. Parang nakakahiya naman. But, rest assured that my
Yung
clinic
basic,
is...
Doktora, na makikita nila dapat sa new normal setup.
New normal setup. Ano ba new normal? No, kasi actually, Doc Grace, the one that I added for my clinic is this. This is an extraoral vacuum machine. So, I use this for, nakikita ba? Yan. I use
Yes,
this
Doktora.
for aerosol procedures. So, when we say aerosol, the one that generates aerosol, yon, di ba? So, ano ba yon? Yung mga oral prophylaxis, tapos yung fillings, yan. Anything that can generate aerosol, I use this. Plus the high vacuum machine. Yan, high vacuum machine. And, syempre, yung air filter. And then, I added 2 exhaust. So, re-engineering talaga ng clinic. So, I added 2 exhaust fan in my dental office. And then, I put barriers dun sa aking mga cabinets.
Abel,
And
pakitulungan
then-
mo naman si Doktora, pakihawak ang camera.
Sobra ka na ba? Hindi. And then, I also limit my patients in a day. That's, yun na yung mga new normal namin. And then, etong suot ko, hindi ito ang normal ko kapag nagtitreat ako ng patient. We use PPEs, and then we use respirator mask to protect ourselves then. And what else? I ask my patient also to wear PPE. So yun. Those are the new norms for us. So actually, mukha na kaming out from the outer space pag nakikita nyo kami. Siyempre ngayon, hindi. So, ganun na kami ngayon.
So, Doktora, that was such a treat. Maraming salamat. We appreciate na not just you having our guest speaker na unang-unas para sa taon na 2021. So, sabi nga natin, very timely po ang iyong pag-guest sa amin ngayong Sabado na to. Bago po tayong tuluyang magsara, Doktora, your last message po sa mga nakikinig sa atin ngayon.
First of all, thank you very much for having me, Dr. Grace, and all the Pharmacia Jimenez team. Thank you for inviting me over. And salamat sa ating mga listeners at sa ating mga viewers. Yun pa rin yung sasabihin ko, prevention is better than cure. So, visit your dentist at least once a year. And make it a habit to do the 3 important things: brush your teeth, floss, and use Oranim. Diba? So, thank you very much and Happy New Year. We really look forward to a better and a blessed 2021. Thank you, Dr. Grace.
Dr. Gigi, dun sa mga gustong mag-avail ng services mo, saan ka nga ulit pwedeng mapuntahan?
Yeah, they're welcome to visit my office. I'm here at 8th floor, Crimson Hotel, Philinvest, Alabang. Yan. And you can also reach me through our Facebook page. It's Abesamis Cruz Orthodontics and Dental Center. Yan. So just look for that. You can ask questions. You can also email me at drgg.abesamis.cruz@gmail.com.
Salamat, Dr. Gigi.
Yes. Thank you very much, Dr. Grace.
We are so blessed to have you with us as our first speaker for the year 2021. Ganun din, Mommy Jenny. Say goodbye. Advance happy birthday to you. It's her birthday tomorrow. So you're
Wow!
31, 32. Mommy Jenny, naka-mute ka. Okay. Yes, Mommy Jenny.
Happy birthday, Mommy Jenny!
Thank you, Doktora. Thank you, Ma'am Grace, for the greetings advance. And yun nga, looking forward na maging maayos yung year na to para sa atin, especially sa health natin, Doktora, and siyempre sa lahat po ng mga nanonood ng viewers din po. Thank you po sa pag-invite po sa akin dito. And personally, very much satisfied po ako dun sa oranim natin, of course. And then, yun nga po, Happy New Year po sa lahat.
Thank you, Mami Jenny. Next week po, ang topic na pag-uusapan natin ay tungkol naman sa managing the weight of toddlers and school-age children. Panoorin lang po natin, 30-second teaser video ng ating episode for next week. Dr. Gigi, sandali lang ha. Show yan.
Sure.
Please.
Yeah.
Miss Roma, ang ating director. For our next episode, okay, yan po mga ka-webinar. Niimbitahan po namin kayo ulit next week together with our subject matter expert na sasagot sa mga katanungan natin tungkol sa weight management sa school children and your toddlers. It's another timely and interesting event for our viewers. Salamat po ng marami. Just visit and like our Facebook pages, Cell Life and Aura Neem, Settle and Settle Active, IC and Norash, Neem Clean Alcohol and Hand Sanitizer, PJC Soaps at Cell Life Pure C and Fermi. Sa mga interesado po sa ating produkto, you can visit our website at www.farmaciajimenez.com. You can buy also our products sa mga leading drugstores, Southstar Drug, Generica Drugstores, TGP Drugstores, of course, sa Mercury Drug at the Generics Pharmacy, sa mga leading drugstores at authorized provincial distributors nationwide. We will see you again next Saturday via FB Live and YouTube Live for another episode of Nutrition and Health Webinar Series. Magmula po sa aking puso at sa inyong mga tahanan, Blessed Sunday po para bukas, Sabbath Day, Blessed Weekend po. I'll see you again next week. Maraming salamat po. Goodbye.